Thankfully, this is actually not true. The PCR tests that we use here at UVMMC on the swabs that are collected from symptomatic and asymptomatic people test for genetic material of the virus that are the structural proteins and not the spike protein. So it detects the Delta variant very effectively. As everyone recognizes, our testing strategies have just recently changed again, and we will continue testing every patient on admission. We then monitor them for any onset of symptoms. If they've had an exposure prior to their admission or were to develop symptoms consistent with COVID, we would absolutely retest them. We don't do surveillance testing on all admitted patients on day 7 at this time, but certainly if they had a need for testing, we would absolutely recommend testing. This is the question of the hour. At this point, the FDA and CDC have recommended a 3rd dose of mRNA vaccine, so either Moderna or Pfizer, for those hosts who are immunosuppressed. People who've had solid organ transplant or on cancer chemotherapy or other biologic medications that would suppress someone's immune system. We're still waiting to hear and expect that there will be more information coming about whether or not and when we would be offering doses for the general population. At this point, there is still evaluation ongoing at the CDC to understand whether or not people who have received a J&J vaccine should receive another dose of either J&J or the mRNA. At this point, there isn't a recommendation for those folks. Although we have seen some breakthrough infections in people who've received the COVID-19 vaccine, the majority of our admitted patients, and in fact the majority of people with infections in the state of Vermont, are in those who have not received their vaccine. So it's a very small minority, far less than 1% in the entire state of Vermont who've been fully vaccinated and then developed COVID infection. Thankfully, the vaccines, even despite someone developing a breakthrough infection, are incredibly protective against progression to severe disease, where someone would need to be admitted to the hospital, and the most feared complication of death. So the vaccines remain incredibly effective. So if someone does develop a breakthrough infection, the risk of them developing severe symptoms is really, really low. I did speak with Dr. Keith Robinson in pediatrics, and he was able to reassure me that although the trend may be different in other parts of the country, we are not seeing hospitalizations or COVID infections requiring hospitalizations in our young Vermonters. In fact, the young folks who've needed to be hospitalized for respiratory infection have been infected with RSV, or respiratory syncytial virus. I know I have an 11-year-old and I can't wait for her to be vaccinated. And so in terms of when to anticipate vaccines for school-age children and toddlers, although it's not entirely known, the timeline, the hope is that in the fall they'll be able to start vaccinating those younger children. Until those children who can't yet be vaccinated are vaccinated, really the most important infection prevention strategies we can use are masking, which, again, I think the kids have done an incredible job tolerating their masks. particularly when they're going to be inside with groups of people. And so those strategies are going to be really important for those kids, especially while we're waiting for them to be vaccinated. If someone did develop COVID-19, the recommendation for them is to receive their vaccine once their symptoms have resolved, they're feeling better, and their isolation precautions have been discontinued. So absolutely people should be vaccinated. That vaccine offers much more additional sort of protection against a future COVID infection. So incredibly important, and absolutely get vaccinated. If someone has COVID already, we recommend that they wait to get the vaccine until their symptoms have resolved, they're feeling back to baseline, and their isolation of their 10-day isolation has been discontinued. Getting the vaccine while infected won't minimize your symptoms during acute infection. It takes the body at least 7 to 14 days to begin mounting an antibody response. So unfortunately, the vaccine is not a treatment for acute infection. We are requiring testing for those folks who can't or choose not to be vaccinated, and that will be weekly testing. For asymptomatic people. Although testing for asymptomatic vaccinated people is not required, it will certainly be available, and Employee Health is working on developing the asymptomatic surveillance testing. Again, will satisfy the requirement for those who are unvaccinated to be tested, but also peace of mind testing for those who are vaccinated and are interested in receiving a COVID test. Although people who are vaccinated can develop infection, it's much less apt to happen, and we want to be able to focus our resources on identifying symptomatic people, testing them promptly, and testing those who are at higher risk for infection, which, based on our epidemiology in the state of Vermont, are those who are unvaccinated. So, really trying to focus our efforts on that. We are tracking every infection and every employee, and we continue to find that even in the few people who've developed a breakthrough infection, so vaccinated and then subsequently developed infection, the commonest exposures are travel and sick household contacts. We are not seeing transmission within the hospital from patients or from one provider to the next. Obviously, we do extensive contact tracing, and so if these patterns change, like they did last year, when people were, may have been exposed with carpooling or lunchtime exposures, we really offered people additional guidance to avoid those types of unmasked exposures. If that epidemiology changes in our contact tracing, we'll continue to update our recommendations. The welcoming committee has reconvened and are working on reevaluating the visitation policy, especially with the changing epidemiology. There's also an escalation policy so that if folks at the bedside are noticing that the visitors are not compliant with masking despite multiple reminders, that talking to their nurse manager and escalating to the ANC and then security if need be is something we absolutely want to support people in doing. as the epidemiology changes, the welcoming committee is continuing to reassess the status of visitation in the hospital. We want to protect our patients from any exposures they may experience, and vice versa, protect our staff from any exposures from asymptomatic patients. The risk of that obviously is really small, given everyone who's admitted will undergo testing. Encouraging patients to wear their masks when providers are in the room is something that we strongly recommend. Some patients may not be able to tolerate mask use if they have severe underlying respiratory issues, and so obviously that's something that's important to factor in. But I know when I do my rounding in the hospital, when I'm on service, I certainly do ask my patients to put their masks on when I'm interviewing them and examining them. So I think that's a good practice for all of us to take part in. The goal is always to mitigate risk. We know that there's no zero risk category, but all of the different protections we put into place, like various PPE strategies, pre-procedure testing, admission testing, vaccination, all of these strategies are layers upon layers of protection, because we know that each one of these by themselves is not 100%. But that if we can layer all of these protections together, it drastically reduces the risk for us to acquire infection while we're here in the hospital, and actually also reduces the risk of transmission to our patients. So that's always our goal. We want to keep everyone safe. We know that the pandemic has been really stressful, and we've asked people to make many changes, sometimes from 1 week to the next, and early on, 1 day to the next, and that's really stressful and hard. And I know that I very much appreciate everybody's flexibility, because again, we're trying to act on the information that we have and make changes when we think that it's really important and going to offer more protection for everyone. So I thank everyone for all of their efforts. I know it's been really hard, but our strategies moving forward will be to, incorporate these tools that we've developed over the last 19 months to ensure that our staff and our patients remain safe, because we will have to continue to respond to COVID in the long term.